Hello everyone, we are here in the last day of EuroPCR 2017. With me is Marco Roffi, who needs no further introduction. I am Piotr Musialek from Kraków, Poland. With Marco, we are to discuss the highlights of this year's EuroPCR in peripheral interventions. But Marco, why are we, two cardiologists, supposed to talk about peripherals? What's the reason?
Yeah, Piotr, I mean, there are multiple reasons. Number one, atherosclerosis is the same disease in the coronary artery or in other districts. The principle of endovascular procedure are similar, although the target organs are different, and obviously we need specific knowledge and skills. And third, the peripheral management is becoming more and more important because the interventional cardiologists are handling now large bore catheters in the femoral artery. So they need to know how to handle complications, for example, for TAVR.
So that's why we have seen this year so many people in sessions such as complex, aortoiliac, endovascular repair.
Indeed, there is a lot of interest, and we had a lot of sessions that were full of people, and more and more people are getting interested in peripheral interventions. I would say that there were a lot of highlights.
But Marco, what are the most important things? What has struck you most this year? What are the new things?
Yeah, I mean, there were several highlights. First of all, I would like to say that the common femoral is no more a unique target of the surgeon. So today, for selected patients, we have very good option to treat in an endovascular way the common femoral artery. Number two, drug-eluting balloons are now established in the treatment of superficial femoral artery, and we have several studies in this year PCR that have underscored the role. While we have to say that for below the knee, the role of drug-eluting balloon still remains to be determined.
So further research to be done.
Clearly. And then obviously now we can reconstruct the aortic abdominal aneurysm with very low profile device, 14 to 16 French device. So many and more people will be confident now that they are used to use this large bore device for TAVR to embrace also endovascular repair of the aorta. And finally, we have also very good data and very promising data on the stenting, carotid artery stenting side.
So not only down from the heart, but also up to the brain.
Up,
so
clearly.
What's important on the way to the brain?
So on the way to the brain, obviously we want to reduce distal embolization. And we have done a lot in this latest years. First of all, with emboli protection devices. The first generation was distal protection with filters. Now we have proximal protection, much more effective. And already last year and this year, very hot, the double layer mesh stent that really should prevent any distal embolization at the time of the procedure.
And also we know that with the prior generation of stents, a lot of events happened after the procedure.
Exactly.
Now with the new generation, with the micronet or mesh protection, are we effective in really preventing this delayed embolization of carotid stenting? Are we going to be as good as endarterectomy or maybe even better?
So this still remains to be defined, but the first experience are very promising. And here we have seen a lot of cases with control of IVUS, and really there is no more plaque protrusion, and even centers that do a lot of this procedure, they really do not see plaque protrusion anymore. So this is clearly major advantage.
Another border crossed, another enemy defeated, yes?
No, not yet defeated. Don't say it too loud. So obviously we will need adequately powered trials. But these data are promising, very promising.
Okay, so thank you very much.
My pleasure.
Thank you for the excitement. And as the last word, I would like to say, please come and see us at PCR Peripheral. This is Milan, mid-October, yeah? Another growing course, yes. PCR Peripheral.
We'll be there.
We'll be there. Thank you.
Thank you.